Welcome to our episode of Conscious Health Podcast. Today we are going to talk about the diagnosis or the ethics of diagnosis. That's the title of our episode. I think we are very excited to talk about that. Is that right, Natasha?
Absolutely, we are. And from a spiritual perspective as well, is looking at the complete effects of a diagnosis, whether it's from any kind of a practitioner. It's also, I mean, I do a lot of kind of like Akashic readings, and
Mm-hmm.
this is one thing I'm always conscious about is in the information that is provided or that I'm providing to the clients, because a lot of the times my clients are in a vulnerable position and they're wanting information. So one thing that I like about working within the Akashic Records, it's very neutral in the sense that it provides background information so that clients can make their own decisions based on the information that is there. However, we all have a responsibility, because the other thing is that for me, I noticed that if we're guiding people, whether it be medically or spiritually or whatever it may be, there is that responsibility in swaying somebody or planting a belief system within somebody that might not really be supportive. Um, so
Mm-hmm.
I'm very, very careful in a sense of when I'm providing information, because I don't want that karma in
Mm-hmm.
that sense
Yeah.
as well. And not only that, I always look into the different options that are available, and then I allow my clients to make those decisions. However, I'm not always in my psychic mind, so to speak. I mean, we're all kind of like quite intuitive, but when I'm not working, no, but and when I'm not working, I am very much a mom or a daughter or a friend or whatever I am. And sometimes I'll get a message that, just asking for advice. And just like, because I'm not working, I'm like, if you're excited about something, as a friend, I'd be like, hey, just go for it, kind of a thing. And then I started realizing, wait a minute, they think that this is divinely guided. So I need to make it very clear that when I'm not working or in session, I'm living a human life. And it was so interesting, because what brought up this topic or a suggestion for this topic is that I have a client of mine that is working through some aspects of, she's actually having some heart and some blood pressure issues. And she has a history of family that hasn't done well with blood pressure medication, and there was a hesitancy in her doctor putting her on some of this medication, and she'd been monitoring her blood uh, uh, rate for the last kind of, I think it was either a month or two, and her blood was fine. She didn't have blood pressure. And so she said to him, look, I don't want to go on this medication because I have a fear of this medication, and my blood pressure has been fine. And she averaged it out, and he was just like, no, I'm insistent on this because, this is what it is. And you could have a heart attack at any minute, and you could have a stroke, and this whole fear that it put her completely into a panic. And it completely deflated her, and it completely changed her mindset. And it was absolutely awful. And I remember doing a lot of listening to Dr. Bruce Lipton, and he talks about the placebo effect, but also the nocebo effect, in the sense of planting in that seed and telling somebody that they might have cancer or that they have cancer. They start believing that they have cancer, and they start creating the cancer based on their belief system. Now, it's very important that, I think, as practitioners, as doctors, as health professionals, or whether it be alternative health or it be clinical health, to have an awareness of the physical, mental, and emotional aspect when providing a diagnosis or a suggestion or information. to customers and clients and, or patients, and the after effect. So it goes beyond the diagnosis, is an awareness, I think, that we all need to be conscious of. And absolutely, sometimes we give out information and we can't really control how it is landed sometimes. And that's important. But I think one needs to look at, yeah, beyond the diagnosis and seeing how that affects our clients, our patients, beyond that. I mean, how do you see it? I mean, you like definitely coming in from that medical field.
Yeah, well, I have so much to talk about this topic, and I really like the suggestion when we decided to speak about that, because it is in a very timely manner that is landing here also, because I have been teaching in my classes that having a medical history and
Mm-hmm.
having the time to interview the patient and to know more about their lifestyle, about how they live, about how they eat, about what kind of emotions are they coping with in the moment that they come to the consultation, is extremely important, because you can, by just being good at listening, being good at
Mm-hmm.
paying attention and eliciting information from people, you sometimes don't even have to prescribe anything. Sometimes you just need to listen to people and change some of the habits and lifestyle choices that they are doing, so that they
Mm-hmm.
can regulate themselves and also allow their bodies to regulate and allow their bodies to stabilize this kind of I don't know, hiccup, let's say,
Yeah.
that they are having in their lives, without giving any kind of drug, without any giving any kind of aid, let's say. But sadly, many physicians are trained to answer quickly, to not listen, and to prescribe. They learn by memory what is the complaint of the patient or the symptom, and immediately, without thinking, they start prescribing. And sometimes
Mm-hmm.
scaring people, just like this physician that you are speaking about, without uh, hesitating about the real side effects of what they are prescribing, and without researching more information, because nowadays science is moving so fast in terms of finding things that are not right for our bodies, in terms of certain drugs that we trusted and we thought that they were safe. But nowadays we are finding out that many of the drugs that we are taking are going to cause serious damage. So
Mm-hmm.
we need to pay attention to all of those things, and we need to be careful with what we are telling a patient, without having a full history of what is happening in their
Mm-hmm.
lives. And I think that's a, very thin line that have or that it starts in the education system,
Mm-hmm.
because we need to educate any kind of health provider to listen to the person and to um, awaken those senses, so those intuitive senses, so that they
Mm-hmm.
can feel the patient and feel what they are asking for, feel the moment that they are passing in their lives, and then review the new information of the medication that we are about to prescribe if needed, or
Mm-hmm.
start with some kind of lifestyle change or nutritional change, and then see what happens in a month or in 2 months. And having a better follow up of the patient without the medication, and then probably starting a medication if needed. No, but
Absolutely. Do you think there's a lot of pressure on doctors these days to prescribe the medication? Because, like, I recently went to go visit one of well, recently, a year ago, time moves so quickly these days, um, with my mom in the sense of like where they did all her blood workup and her doctor, I was quite happy, was quite conscious in the sense that he said, okay, look, your cholesterol levels are a little bit up, but he was like, they're so
Mm,
borderline.
yeah.
And he says, look, I could prescribe you something, but he says you can change it on, just watch your food intake, and that absolutely shifted stuff for her. However, is that many doctors would turn around and go, okay, this is what it is, just onto your pills, or, kind of thing, onto that pharmaceutical instead of saying, okay, look, what is really going on there? And that's what our podcast is, a lot of it is about is, okay, what is the mental, emotional, where is that might be a symptom, but where is what's the cause? What is the root cause of all of this, which is so important? Because a lot of the times, it is my belief system, as it is right now, is that usually when there's an ailment, there's a deficiency somewhere physically, mentally and emotionally, there's something that is connected to that, and that environmental in aspect that is affecting our bodies, as well as the physical and the food that we intake as well.
Yes, and I recently lived that in my own life, and as I nowadays try not to take any kind of medication unless I really need it. What I did, I got sick about with my throat. Started with a sore throat, then my nose become stuffed, or I don't know
Mm-hmm.
what or congested, very congested. So I couldn't really breathe easily, and I just left the disease progress in terms of feeling more what was happening inside of me, feeling how the symptoms were evolving by themselves. And it is so amazing when I know that it's difficult because you are in pain. Sometimes
Mm-hmm.
it was not so much pain, but still is not pleasant to be sick.
Yeah.
So, but I was patient. I was very attuned with the body, attuned in terms of uh, paying attention to what it was happening to me.
Yeah.
And I reduced the amount of exercise, but I kept doing exercise so that it flowed faster.
Yeah.
And I started to sleep a little bit more than usual. And one day it was very marked, the symptoms, that my body started having fever. Not so much, more or less 1 degree, 1 degree above. And I felt a little bit of pain in my body, but I could live with that. And I said,
Mm-hmm.
well, that's okay. The next day, I was going to a trip, and I was going to change the environment in terms of the pollution of the city towards the clean air of the sea. No,
Yeah.
and I immediately, when I arrived to the vacation site, I started to breathe differently, and I started to feel different. But one day before was the moment that my body decided to raise the fever up and to give me that pain because it was working inside. Because
Yeah.
those are the symptoms that your immune system is going to give you. Fever is good. Well, if it's
Yeah.
not very high and
Yeah.
many days or many hours, if it's too high, and having pain in your body is also good because that represents your immune system being in charge of attacking the bacteria or the virus, whatever it is, because I didn't even know what I have. No, I didn't care really. I just knew that my body was going to recover, and I was trusting in my body that it was going to do the job. And I said, I have to be
Yeah.
patient. I don't have to take anything on, even if I had that, I don't know, like desperation to breathe better. But I said, no, I have to hold on. And it was just 4 days. It was just 4 days that I had those issues. Just one day, I really felt uh, higher pain, let's say, but the body did the job. The body did the job. The body healed itself.
Mm.
And it has been, well, since that disease, I had 5 years at least without any other disease. So, what we do when we allow our bodies to heal by themselves, if it's not something, of course, urgent, or if it's not something that is going to risk your life, what we are doing is that we are strengthening the immune system
Yeah.
again, and we are balancing and giving the body the trust that it needs from us, because we are so desperate right now to give the instantaneous solution to feel better in just a couple of hours, that we cannot hold on some discomfort. And that
Yeah.
is also not good, because if at the very uh, or the slightest discomfort that we feel the urge to take some pill to ease the pain or to shut down the pain, then what you are doing is that you are weakening your
Mm.
immune system, and you are weakening your attunement with your body. So you are disconnecting. So the body is going to be, by the time that you keep repeating that pattern, your body is going to become lazy. Not because it
Yeah.
wants,
No.
because you want, because you are so desperate for the solution. No?
Yeah, and I think that is reflected in society as well, and in
Yes.
not, I mean, if we look at even kids like, I'm bored. Yeah, enjoy that little bit of discomfort. It might birth some kind of like
Yeah.
creativity, you know. But it's it's so true that we're just this quick fix. Everything needs to be like, nothing can be uncomfortable, and it's very very strange in the sense that, because I was recently in India, and I think the body just knows. Well,
Mm.
it's like my body was preparing to go. So I was very, very busy, and I knew I was going to be doing a lot of shifts. And it's so interesting because when a client books a session, when we book a session, whether it be with, any kind of health practitioner, and I see doctors and all those, anything that helps with health as health, your body, your mind automatically goes into that preparation and getting ready for it. So a lot of things start to surface, and then it's quite interesting. So I'm also trying to put my money where my mouth is, and the suggestions that I give to my clients, I tend to do to myself as well. And I got kind of like hit with this kind of like extra stress because I've been, trying to fix things up before I went. And I ended up having this bizarre pain, and I knew that I get like a muscular pain, like I carry my stress. Sometimes I get kind of like knots, or the muscles in between my ribs like tighten up, and it hurts when I breathe. But because it was kind of like in my back near my kidneys, I was just like, oh, I don't want to be stuck in India with this. I thought, let me go and check it out. And it was so interesting because the doctor sent me quickly to the day clinic, because knowing that I was leaving on Monday, this was now a Thursday. And they're like, if something's wrong. So I did all the blood tests, and I'm like, I'm going to be fine. And then at the end, they're like, no, they're like, everything is fine, of the EKG and all the rest of that. I'm glad I got a full workout, and I'm absolutely healthy, which is great. It was just like, it was that muscular. So he gave me a lot of painkillers. And I was like, okay. And I was like, so I don't mind taking one or two. And he's like, no, you've got to take them
Eight
every
hours.
4 hours or every 6 hours or whatever the hell it was, like on. And I was like, but if I'm feeling better, do I need, yes, you need to keep taking it. And I was like, ah, I was like, I was battling with it internally and kind of like, I don't want to take this. If I'm feeling better, obviously I don't need it, kind of a thing. So it was very interesting in that conundrum within me, but it was always kind of like, okay, I'll just be guided by my body in a sense, because sometimes, yes, it does need the rest, but it's that checking in to see, okay, this is what's in alignment with me. And it did help me. And I did take some, but once I was there, then I ended up doing some other stuff. And I've noticed that I've come to the conclusion that when we're physically, something's going on with us, it's either a clearing, so a flushing out. So for you, it was a flushing out with your nose, opening up your throat chakra, getting rid of kind of like uh, everything that you're holding on to. And in Ayurvedic medicine, they actually talk about this time of springtime as the flushing out of your system, the flushing out of toxins, almost kind of like how sometimes the ice starts to melt on the mountains and starts to fill the rivers. So too with us, we start to release a lot of mucus. We start to let go of a lot of things, especially from the winter of that part of like that hibernation of holding on to things. Things start to flow within our systems. So I tend to see certain when I'm sick is it's either a release or it's an activation, something that's bringing in or something that's integrating in the system is kind of like we call it in our like in our spiritual health perspective, an integration of an activation of an expansion of something new that's coming in, which is usually based on some kind of like if you've gone through a big emotional or spiritual kind of like understanding, or if you've released or noticed a pattern that you've done some shadow work, it's almost like your body needs to catch up to the soul, so it's not so heavy, it kind of a thing. And it makes sense because if we think about any trauma that we go through or any ailment that we have, it almost creates like an energetic cyst within our fascia, like a little pebble that gets stuck. And once you release that, the body needs to adjust. So it's almost like if you used to walking with a pebble in your shoe, and now you don't have it anymore, your body needs to like, how do I walk without this pebble now? So there's that integration, that adjustment that we tend to see that is coming up. So I being conscious of this, I absolutely noticed that before going to India, the preparation of the things that surfaced, and then I had quite a few activations in India, and then on the way back, the release of like, yeah, I got a bit of Delhi belly when I got back instead of when I was there, which I thought was very efficient because it didn't mess with my holidays, and I got to do the detox when I got home in the comfort of my own home. But it was that releasing of the old systems now that I'd kind of like spiritually, mentally, and emotionally kind of like shifted within myself, the body catching up to that. So I found that to be very, very interesting. At the same time, but when we're in observation of it, when there's an acceptance or an understanding that that was what the body is doing, it allows us to tolerate those days of uncomfort, right? It allows us to understand, okay, this is what my body's going through, so let it just it actually it creates a patience within me and allowing the body to do what it needs to do. Like you say, of course, if it becomes severe, absolutely, I would not hesitate in going to see a doctor. But if it was just like that checking in and that knowing that body and going, okay, is this still okay? As I move through that, and yeah, I feel so much greater for that as well after that. But there's this. I think that we're so out of touch with our physical body that it's we don't understand it, we don't know it, we're so not used to being in the uncomfortable, and needing to fix it really, really quickly. We bypass a lot of our healing physically, mentally, and emotionally because it's this quick fix that we bypass it until it gets to a space where it's absolutely chronic, and then we're forced to deal with it.
Yeah, I love the way that you spoke about the Ayurveda system and how that ancient wisdom is giving us so much attunement to the seasons, to nature, to what is happening, And when you start thinking about things in comparison or with the help of nature, you understand so much things, because that what you mentioned, that many of the season of winter we keep holding things and we keep being congested, just
Mm-hmm.
like my nose was. And then when we arrive to spring, that everything start to be warmer and melting and flushing things out, and the trees start to flourish again and have
Mm-hmm.
again green leaves, and leaving the old, let's say,
Yep.
out. So that's what the body did in my case, because
Mm-hmm.
it is very funny that, but I started to feel sick one day after I had some discussion with my brother about something that happened with him, that reminded me of certain conflicts that I had when we were younger. And the discussion that we had, in the end, of course, it resolved, and we
Mm-hmm.
had a good time talking about the things. But there were some moments where I was really triggered by what happened, because he suffered an assault, and he wasn't injured, but he put himself in danger irresponsibly, in terms of knowing the place where he went. And in spite of the advice that I gave him, that I told him, don't go to that place, just ask the people to see them in other place of the city. And he ignored that. And then the thing happened. No, the assault happened, and he told me, and he was really scared and worried. And after understanding that, and after being compassionate about that, I also told him, you see, I'm not telling you the things because I want to hurt you, or because I am just against you, or because I think I know more than you, or whatever you think that is. I'm just saying that because I care about you and I love you, and I didn't want you to feel anything or to be threatened by this insecurity that we are living now. No? And it's funny, as I told you, next day the starts with the sore throat. So I said I was also thinking about those things, and I tried to look for the pattern of thought that I was developing through that conflict,
Yeah.
and it all makes sense when we start seeing the pattern of thoughts that you have, and
Mm.
when you see that regression that you do sometimes to when you were a child, and
Mm-hmm.
all of those conflicts that starts again being relived in your memory, that's when you start feeling bad, and that's when your body starts having that conflict inside, and it will look for an outlet. So the
Yeah.
outlet many times is those symptoms that can be uh, easy, that can be sometimes not so severe. And if you pay attention and you let them go and you understand yourself,
Mm-hmm.
then things are going to flow and find the rhythm again, no? But if we start to not paying attention and trying to suppress that conflict and
Mm-hmm.
suppress all of those things that are surfacing in your life, then it's when the disease becomes worse, no?
Well, it's because it's been suppressed all your life. So it's
Mhm.
been not one, not two, because we come in with themes that we've come to explore. So we will call people towards us that will mirror, that will give us those themes in order to express. So like you, I tend to be a little bit proactive when it comes to that as well. So say for example, if I do have a cold and my lungs are affected, knowing that, you know, our lungs can carry grief. It's looking into actually feeling into the lung and if we do it from a meditative place where you connect into the lungs as if they were a person and you spoke to them in a sense of, and we do this very much in a kind of like a somatic sense. I usually say, if you know, if your lungs were to speak, what would they say? And a
Mhm.
lot of the times, or connecting in and saying, okay, what is the memory that you're releasing? What is the pattern? What is the conditioning? What is the belief system that is there, that has come up, that has surfaced, that needs to be released? And a lot of the times it will be connected to what you're going through in your life, whatever it may be. And a lot of the times the grief is stuck there because of a sadness that we weren't able to express when we were younger, or a grief that we weren't able. So it creates that little energetic cyst, as we call it. And when we're ready to release them, because we've suppressed them, these tend to surface, which is why sometimes, and this has happened to me a few times, where, for example, like I had some dental work done, and it,
Mm.
like, my whole neck was affected, and then the physiotherapist, you know, the chiropractor pressed in on the neck, and the memory showed up. So I remember that that's where that pain came from 3 weeks ago, even though it took a while to make its way. That old tension of, you know, having mouth work done, because poor dentists, not many people enjoy going to the dentist. I'm one of those.
Yeah,
But
I
it's
don't.
it's kind of like that causes that tension, that stress, that trauma, that energy that is stored in the body somewhere, just ended up landing kind of like in my neck. And then I ended up going like, oh, I must be stressed, you know, when I got to the stage where I couldn't, you know, look both sides to drive. I was like, maybe I should go. But it was just almost kind of like, yeah, that's where that memory came in. It was that physical trauma in that sense. But I've also had times where I've had a cold or a flu, and I've gone into that, and it's kind of like, okay, what childhood trauma is coming up, or teenage trauma? What is the trauma that is surfacing that needs to be released, or a belief system, or a pattern, or some sort of a conditioning? And usually once we discover what it is, the symptoms tend to dissipate a lot faster as well.
Mhm. Yes, yes, because I think that it's so wise, our bodies, and so wise this
Mm-hmm.
integration of the mental, of the physical, the body, and the
Mm-hmm.
spiritual sides, that when we allow this integration to take place, everything moves faster, because we are these three big pillars, no,
Mm-hmm.
of the mental, of the physical, and the spiritual. And if we align those three, we will give the power, the real power that our bodies have to speed up the healing process. But when we separate and treat them
Mm-hmm.
as a just as a symptom, just as something that has to be fixed,
Mm-hmm.
and we don't even understand, and we don't even listen, and we don't have ethics in interviewing a patient, that's when
Yeah.
we make the mistake of trying to fix the symptom or to cover the symptom with some drug or medication. And then with time, you will start to have again the same symptom plus the side effects now, because now you have
Absolutely.
the effects of the drug, that of course that is going to cause some effects, no.
Yeah. One other thing to consider that was coming to me is that we also forget that our bodies are mostly water. I think it's 72% water, and that water holds memory as well.
Yeah.
And as we're listening to those diagnoses, as we're listening to the advice or the suggestions, the body's absorbing that, and it's bringing that knowledge, that wisdom, it's aligning to the frequency of our thoughts, our emotions, of what we're hearing. So if, you know, our thoughts fuel our emotions, and our emotions are really just energy in motion, and water tends to amplify, is a conduit, is an amplifier. So we tend to amplify whatever we're receiving. So it becomes quite important to not only think about what memories are being held within our body, within our systems, but the environment that we're creating for them with our beliefs and our emotions. So that becomes very, very important. And I agree, it's not, sometimes it is bad news, and sometimes we need to move through those things, but I think it needs to be handled with care and an understanding. And I think that the power of hope is always important. Once we deflate that, or once we disempower people, um, I think it accelerates the whatever we're doing, and it'll accelerate. Whether you're empowering somebody, it will accelerate the healing. Whether you're disempowering somebody, it will accelerate the diagnosis or confirm or affirm the diagnosis. And I think I read a statistic that the biggest thing that people die from in the States is a misdiagnosis. It's from the actual medication that is prescribed rather than cancer or anything else, any of those diseases. It really is around the drugs and misdiagnosis that is there, which is why it's always good to get a second opinion
Yeah.
as well.
And it is funny, but that same advice is the one that I gave my students, that they should never stay with the first diagnosis or the first prescription of something, because, well, nowadays, sadly, we cannot trust also even physicians or experts or whatever the name they have, because many times they are used to this automatic action of prescribing. Sometimes it's pressure because of the system, because they need to have, well, in a fast-paced life that we live in many of the public hospitals, they need to comply with a quote of patients, and they have certain time for each patient. So if they have, I don't know, let's say 20 minutes per patient, and they need to fix that patient in 20 minutes, of course that the first action that they are going to do is prescribe something, and not even listening to the person, because they say, okay, you have this. They don't even see you. They are
No.
in the screen, and they are writing down the prescription, and that's it. Take this every 6 8 hours, as you mentioned also, and see you next month or next 6 months, whatever it is.
In the United Kingdom, it's even worse than that. And I'm sorry, like, when we first got here, one of the kids got sick with tonsils, but she had an underlying health history. And I phoned. So again, here you don't see anyone. You phone them first, and then they decide whether you come in or not. I've had mixed. I had really, really good service here, but this was one of my first impressions. And it's unfair for doctors as well, because I phoned the doctor and she said, okay, I was like, okay, now that I've eventually gotten this doctor on the phone, I'm going to give her a list of all the symptoms of what I need to do, case history, everything, because my daughter was getting treated for this autoimmune thing that she had going on. And I hadn't been able to get into the medical system here to carry on that treatment in the UK from Canada. And when I got to speak to the doctor, I said, okay, great, I'm speaking to you now. And I'm going to give you a list of everything that's been happening. And she said, you can only tell me 3 things. And I said to her, what if I have 5? How do you not know that they're related or could be anything else? She says, I've only got 5 minutes. I said to her, then I will speak really, really fast.
Yeah.
To try and give you as much information as possible. But it's also, doctors' hands are tied. And I ended up needing to, because she was like, is the other one urgent? And I was like, no, it's not life-threatening. But it's like, it's something that needs to be treated, until eventually I was just like, we're going to the hospital and we're going to take it in because the child was in pain. And I'm like, I'm just taking you in because it's the only way that you will actually get seen on the system, because it left very little faith in the health system. And it's I think a lot of doctors' hands are tied, which is really, really hard. If you think about it's a vocation. You go in because you want to help people, right? You go in because hopefully there is a passion for it. It's not around the money, it's around the caring, the being of service. And you're unable to.
Yeah.
That
Yes,
must be
yes.
really, really difficult.
I feel that, and I also see that it all begins with the education. Again, I'm sorry to come back to that, but we are also educating very poorly physicians or healthcare providers because we allow them to not know the important information of the body, not know the body and how it works. And we are more worried about them memorizing things to answer quickly or to have the correct answer. And that shouldn't be the purpose of any kind of education, to have the correct answer, because nowadays you can find the correct answer in whatever AI that you consult, no? And that's not the purpose, but how did you arrive to that answer? And how the
Yeah,
body starts the process of healing. Do you understand that? Do you understand that your body needs certain kind of nutrients, certain kind of lifestyle choices? Do you understand that you need also to know what is happening in your life in terms of the relationships that you are having, in terms of the conflicts that you are having, so that your body works in alignment with all those things? And they don't know how to answer that. They don't know how to think. They just know how
yeah,
to respond. So
yeah.
that's a big issue, I think.
I think one of the biggest things that I that I teach when whether it's doing Reiki or whether it's doing any kind of like energy healing work is to it's about holding space in the sense of listening, because it's listening with the intent of understanding rather than an intent of answering becomes really, really important. Because a lot of the times, if we don't ask the questions to get to, again, the cause of it, we don't end up, we can't end up supporting that person. And a lot of the times, I notice that with asking questions to understand or just listening, that in itself creates a lot of the healing, because a lot of people aren't heard,
Mm-hmm. Yes.
aren't seen. And I think it becomes a little bit harder, especially with the older generation, because it's the only time that they are seen and that they are heard is when they're going to the doctor.
Hmm.
It's that level of attention, which also needs to kind of like, we need to come up with a different solution for that. But I think it's so important, because again, that misdiagnosis, because we don't know what is surfacing. And yeah, it's important. It's We need to look beyond the advice or the diagnosis or the suggestions or the support. And I think coming at it from a very neutral perspective is important.
Yeah. I'm sorry for all these disappearances, but my battery was dying.
No magic tricks.
Yeah, I'm doing magic with my computer now. But I'm listening. So
Good.
I agree totally that we are used to, and we are having a crisis also in terms of not being able to talk with someone and to be listened to. That
Mm.
I also was listening to a podcast with a psychologist that speaks about the relationship issues, and she was telling that many of the men, most of the men nowadays, they don't have anyone to speak with, and this is a crisis for that is more common in men because we tend to repress more this kind of speaking about the emotions And we also tend to, when we gather between men, we don't speak too much. We really just watch a game or drink something and speak about very superficial and trivial things many times. But when we need to speak about something that is happening in our lives, we really don't find that safe space to speak about. So that's also affecting the health of many, many people, no?
Absolutely. And who do you speak to? You speak to your doctor, your priest, your lawyer. It's
Yeah,
like, it's one of those
exactly.
things my
Yeah.
mom's always said. The only time you have to completely say everything is to your doctor, your priest, and your lawyer if you need to, kind of a thing. But it's true, but it comes in from the conditioning of suck it up, move on, don't be a girl, don't be whatever it is, boys don't cry. It's got kind of like that you're taught from a very young age, and it's also intergenerational, that aspect of keeping quiet, and not expressing any kind of emotion as well. I mean, I grew up in South Africa, and I grew up from the thought that crying doesn't fix anything, so just get on with it, move on. Life is tough for everybody. Like, and it's just like, okay, this is just the way it is. Let's move on. And you suppress, 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 put in that memory somewhere in the body that eventually it starts to surface later on. Um, and our bodies is the last protocol. I think it's the last effect of what is in behind physically, mentally, and emotionally. It's by the time it hits the body, it's already been through all those other aspects of us. And it's the last one, and the body starts giving us warnings. It's a couple of colds, it's a slow down, it's a muscles, it's a you need to take it easy, and then we ignore it. We're just like, it's okay, I'll just push through it, because our bodies are amazing mechanisms. The machinery is just incredible, until it gets to a stage where those warning signs become okay, stop, done. You're right.
Yeah. It will stop you. It will stop
Yep.
you until you do something. It is funny about it because I remember when I was like 20 or something like that, and I also like to do plenty of things. I studied and I gave classes and I swam and I competed and I did everything. So I was sort of unstoppable to be in
Yeah.
one place and one moment and that's it. And my body gave me fever so that I stopped. I got sick very, well, not very frequently, but sometimes more or less every 6 or every 8 months. I had some issue with my stomach. For me, it is more reflected in my stomach.
Mm-hmm.
And and then I knew what it was. I knew that it was stop or I will go further. No,
Yep.
so I pay attention. I try to listen. I try to say, okay, I'm going to pay attention to you, and I'm going to be in my bed. I'm going to rest, and I'm going to recover 2 or 3 days, whatever it needs, and
Yeah.
and then again I did it. No, but it is so funny because your body is going to tell you whatever you need, and you told a very wise truth also that when it arrives to the body, when you start having symptoms, it has passed through many signals and
Mm-hmm.
many sometimes synchronicities that you have in your life, but you were not paying attention.
Yeah.
And once it goes to the symptoms, and once you observe something that is surfacing in your body, is because it's not too late, but it's late.
No.
But it's late.
Yeah.
So it's a signal of now you really have to pay attention, or the symptoms will become higher. So
Yeah. It's kind of like the body goes,
yeah,
and it's like, hey, and then it's like, hey, no, you
yes,
know.
it's yelling at you. It's yelling.
Yeah. But it's the same. Like it's quite hard, because you talk about when you were 20. When I was 21, I came traveling to Europe, and I found it really, really hard. So I just worked. I worked my way into adapting. So I had three jobs. Like
Mm.
I've always had an office job, and then I had in the UK we'll have pub jobs, and then I used to work in a nightclub.
Oh.
And it was so bad because, like, on a Friday, I'd work 21 hours.
Mm.
Like, it was like, but you're 20, who needs sleep?
Yeah.
Like, our bodies are like awesome. And I remember I sustained that for 3 months. And,
Mm.
uh, and then I had a friend come to visit me, and I was like, okay, so I took some time off, and my body went, yeah, you're taking time off. I got so sick. Like, like
Mm.
my muscles were so sore that I actually couldn't even sit on my bum. I had to lie flat for 3 days
Mm.
when my friends came to visit, because it was just like, it was the only way that the body was going to be like, you're done. You're right. It's like, you're done. And I used to remember I used to have Thursday nights off and Sundays, the full day of Sunday. And then we used to go out because we didn't go out. So who needs sleep then? Who needs proper nutrition? Our bodies are just like, they're like machines. They're like going all the time. So it was awesome. Um, so yeah, it's amazing. It's the quicker we learn to be in our bodies. That's the other thing that I see from the alternative, I suppose, medicine side, is that when our physical body is in so much pain, or when we're holding on to so many memories, we tend to use a lot of distractions to not deal with that mental emotional aspect that we're going through. And
Yeah.
we say it's hard to be in our bodies because the body is in so much pain that our minds are somewhere else. And we do this by distracting ourselves. So for
Mhm.
me at that time, I was distracting myself through work. A lot of people distract themselves by helping other people instead of spending time with themselves, which was so scary that during that time of the pandemic, a lot of people were forced to spend time with themselves. They were forced to spend time going within, time dealing with all of that trauma that has been suppressed, that we didn't get that opportunity to heal because there was nowhere to go but inside.
Yeah.
So I think that's where it becomes really, really important to have a look at our health from all perspectives as well.
And it's also, I think that we can more or less wrap it up with these final thoughts about this time of the pandemic that we have, and the stillness that we were forced to do and to experience. And also, all of those things gave the opportunity for many people to go within, to find that
Mm-hmm.
pain, to deal with that pain, because they didn't have anywhere to go, and they couldn't do work sometimes,
Mm-hmm.
some of the seasons of the pandemic. And now what we are seeing is those high rocket statistics of many diseases and illnesses that are being present, because it's the consequence of having that time to deal with that pain, to address that pain. And now it is, we want to go back to the normal speed of life, and many in many parts of the world it's already in that pace or even faster.
Mm-hmm.
And we are having very severe consequences in terms of the health, because people are trying to do again the same thing: shut down the body, shut down the messages. And if we keep playing that game, well, there is a wiser option, that is this collective consciousness and this
Mm-hmm.
energy that we are generating, that is going to give you the symptoms that you are producing by not listening, no, by not having that awareness. And it is just as simple as sometimes journaling. Sometimes journaling is the replacement of speaking with someone,
Mm-hmm.
and that can heal you in a lot of ways, because you are having a dialogue with yourself,
Yeah.
but you are having that dialogue in a third person.
Hmm.
When you become that third person, that you are witnessing the things that are happening in your life, at least you release some of the pressure, some of the pain, and some of the emotional, uh, I don't know, conflict that you can have.
Hmm.
No?
Absolutely. Absolutely. Yeah, I mean, we could talk for a long, long time about it because there's also
Yeah.
the intergenerational aspect that we carry as well.
Mm.
And
Yeah.
perhaps maybe that's one thing that we could talk about too. Because if we look at it from even the perspective of you saying men don't communicate, we've had to shut off a lot of that feminine aspect of ourselves because if you think of our forefathers going to war, things like that, they had to switch off certain things in, within themselves to be able to survive that,
Mm-hmm. Yeah. I think
right?
it could be a great segue to talk about that topic, intergenerational pain or
Mm-hmm.
damage, whatever it is now. And I don't know if you want to close with uh, something that we missed.
I don't think we missed anything, but it's really to say, listen to your body, connect into your body, be in your body. A lot of the times we don't, nothing to do, but just to be in understanding, what does it feel like, and stop avoiding it and look at the signs that are coming up. This is a constant battle, even for me, is something we're so taught to override all of this that
Mhm.
it's almost look into it. Every ailment, again, is either a release or it's an activation. Look at it. It's a memory that's releasing. It's something that is surfacing that your body's asking you to pay attention to. So pay attention to it.
Yeah. Thank you. Thank you, Natasha, for giving me this topic to talk about. And I thank everyone for listening and for paying attention. And just my last thought that I want to share is be uh, be strong, own your power in terms of knowing your body better than anyone else, because no one can feel what you are feeling. No one can know what you are passing through in your life. So allow that knowledge to settle down and recognize that, so that you also align the emotional, the body, and the mental aspects. No? Thank you.
Absolutely. Thank you, everybody. Thanks, David.
Thanks. Bye.